Hello all, this is Dr. Alsup, and in this dissection video we will be discussing the peritoneum and peritoneal ligaments associated with the pelvic cavity. Recall that the peritoneum that we discussed in great detail in the abdomen does extend into the pelvic cavity, but it doesn't extend all the way to the pelvic floor. Instead, it will reflect over the viscera in the pelvic cavity, and that peritoneal organization will be dependent on which viscera is present in an individual. So we will start with how the peritoneum will be organized with the presence of a uterus while looking at this superior view, which you can see is the fairly dominant structure that is located intermediately. So this is the uterus right here. You can see that it gets a little less opaque over in this region. So we're looking at peritoneum here. The uterus is intermediate. The bladder is going to be more anteriorly placed and up against the pubic symphysis. So it's going to be deep to this region right here. And the rectum has been tied off, and you can see a bit of it right here. So we get an idea of some of the basic structure. With the uterus present, there will be two peritoneal pouches. You're going to have the vesico-uterine, meaning thinking about the bladder. That's going to be between the bladder and the uterus. So this region right in here will be the vesico-uterine pouch. And then from the recto-uterine pouch is considerably deeper and is in between the uterus and the rectum. So it's going to be right in this region. Sometimes you hear this referred to as the posterior cul-de-sac, but you'd be tested by us as the recto-uterine pouch. There are going to be two peritoneal ligaments that are observable from this superior view as well. You can see extending laterally the uterine tubes, laterally from the uterus. So you have your uterine tubes there. You can also clearly see an ovary here on the left side. And I always try to figure out the visceral structures as best I can before trying to figure out the peritoneum. That really, to me, is just more intuitive than just trying to pick out the peritoneal pouches or ligaments. So extending from the lateral pelvic walls from the uterus, and also closely associated with the uterine tubes and the ovaries, is the broad ligament of the uterus. So you can really see it pretty clearly right here, but it's going to extend kind of all over this region. Anything extending from that uterus or associated with the uterine tubes or the ovaries. We will talk about this broad ligament in a bit more detail in the next slide as well. The other peritoneal ligament I want to discuss is the suspensory ligament of the ovary, sometimes referred to as the infundibulopelvic or IP ligament. And you can see here, this has been dissected out a bit, so it's not quite as clear as you would like for the ligament portion, but you can see the gonadal vessels, specifically the ovarian vessels, that are traveling in this region. And particularly as you kind of get down into this region, you can see some of that glistening peritoneum, but peritoneum would be surrounding this whole region right here. It's been dissected a little bit in this image. And that peritoneum is referred to as the suspensory ligament of the ovary. And so that will extend obviously to the ovary. It will actually become continuous with the mesovarian portion of the broad ligament of the uterus. Okay. Let's look at these same structures that we just talked about in that previous image, but with a bit more of a posterolateral view and a little bit closer up as well. So let's start with the broad ligament of the uterus, but as I mentioned, always try to get your bearings in regard to the viscera before trying to figure out the peritoneal structures. So here is the uterus. It's going to be kind of more intermediate. The bladder here has been open, but this whole structure right here is the bladder. The rectum is going to be further back in this region, not quite as visible here. You can see the uterine tubes that are going to extend laterally. You can even see it going all the way to the infundibulum portion of the uterine tubes. You can see some fimbriae here. So these are the uterine tubes. And you can also see the ovary located right in this region. So pretty clear in terms of the visceral structures. So we have the viscera down. Now we can start understanding where the three parts of the broad ligament of the uterus are located. So the mesosalpinx is going to be a trumpet kind of shaped instrument. So it's kind of indicating the shape of the uterine tube. So this right here, covering the uterine tubes on almost all its surfaces except for the abdominal ostium over in this region, is going to be the mesosalpinx portion of the broad ligament. The mesovarium is located on the anterior surface of the ovary. So it's going to be right in this region right here. It is, since we're looking at a posterolateral view, this right here would be the anterior surface of the ovary. So the mesovarium will be right in that anterior portion, and it's actually the smallest portion of the broad ligament. And all of the rest of the broad ligament of the uterus is the mesometrium. So typically when you say the broad ligament of the uterus or point it out, a lot of times you're pointing at this mesometrium portion of the broad ligament. And it's going to extend laterally from the body of the uterus all the way to the lateral pelvic wall. And I just think this is such an excellent picture of the broad ligament. Kind of at this bottom portion of the broad ligament is where it's going to meet with that transverse cervical or cardinal ligament. You also have a really nice view of the suspensory ligament of the ovary as well. And I almost like this image a little bit more in terms of the suspensory ligament because it's a little less dissected than what we had in the previous image. So you really get to see what it looks like in situ with the peritoneum covering those vascular structures. And you can see it's traveling directly to the ovaries. It's going to be continuous with this mesovarium. So this is that suspensory ligament of the ovary. All right, let's look at another superior view, this time in a pelvic cavity that does not have a uterus. So the two dominant visceral structures are going to be the bladder, which is going to be anteriorly placed and deep to the viscera. And then you're going to have the rectum, which is going to be deep to the peritoneum in this general region here. You can even see a bit of the sigmoid colon in a little bit more superior portion. And so this reflection between the bladder and the rectum is going to be the rectovesical pouch. And you can see that with the peritoneum present, it is difficult to see the deeper or more inferior structures that are associated with the pelvic cavity. So things like the seminal vesicles or the prostate are not as easily viewable when the peritoneum is still present and hasn't been dissected. There are certainly other peritoneal structures and ligaments in this area, but these are the only ones that we are going to have you identify in a practical setting. Other ligaments discussed in the learning objectives are of course fair game on quizzes or the final exam. Excellent. Thank you for your time and attention here, and I hope you have a great rest of your day.